again, AHE and the Chamber of Commerce and Health, we thank you for this year's 2012 Diversity Gala. I know it takes a lot of work, and I want to start by thanking our president, George Sepperfeld. Let's give him a grand hand. I think he's done a phenomenal job. George is the person that is always on the mission and always making sure that the agenda for the Latino community on health is on the forefront. And I am right next to him because I believe in his mission and his agenda. He has taken this organization to great heights, and you can tell by the caliber of people around and the sponsors that we have here. So once again, muchas gracias de corazón on behalf of the organization and the committee. Gracias. I will start, and I will get out of your here very briefly with the national partners, Edna, muchas gracias, Miguel Centeno, and Tina, thank you very much. They're great national partners. And then we have Greater New York Hospital, we have Lee Program, which help us a lot, and Mary Medina, muchas gracias, tell Lee that we love him. He's a gentleman whenever we go into the office, and you'll make us feel like family, and you are very, very, very nice when we get into the office. Keep up the dollars coming, thank you. Dinero. Regional partners, Empire Blue Cross Blue Shield, thank you very much. Grupo Parada, thank you. Helplex, thank you. New York Presbyterian Hospital. North Shore LIJ, Howard Gold. Great friend from LIJ. Thank you for Michael Down. We go every time we go to North Shore, they welcome us, and believe me, he's like our mentor. Howard, on behalf of all of us in the committee and the Latino community, thank you very much. Que Dios te bendiga. And Gus is here from Lennox, so thanks a lot also. There we go. Diversity partners, we got Acacia Network, thank you very much, Acacia. Continuum Health Partners, thank you very much. Quest Diagnostics, and also we have a new members coming in here, which are MetLife. Jason Gold, thank you very much for your support and a new member to our organization. Non-for-profit partners, Express Scripts, Montefiore Medical Center, Howard Wood Johnston University, Mount Sinai Hospital, VNS New York Choice, and with this, and then we have the New York Medical School of Choice. Thank you very much. And our other sponsors. Thank you very much. If I missed anybody, blame George. Monica. Anyway, on behalf of all of us, and I'll say a few words in Spanish. Damas y caballeros, muchas gracias por apoyar esta organización de salud. Para mí es un orgullo ser el chairman de esta comida. Que Dios me lo bendiga. Disfruten la fiesta y pasen buena noche. Gracias. Thank you very much.
Good evening, everybody. The first thing I really have to say is, boy, this group is really guapo. So you're a really handsome group of people. And thank you for dressing up and recognizing that this is such an important event that you put your Sunday best clothing on. I want to thank, first of all, the New York City Health Commissioner, Dr. Thomas Farley, for honoring us tonight and serving as keynote speaker. Round of applause for Dr. Farley. I also want to thank all the members of our roundtable of professional health associations. There are leaders that represent Hispanic nurses, dentists, mental health workers, social workers, medical students. There are our next generation. Thank you very much for being here tonight. I want to thank all the other individuals that have come here tonight. Really, what I want to say is to give you a very brief outline. For the last 12 months, we've addressed 3 major events during the course of the year. Events on Affordable Health Care Act, our first scholarship reception, which we had at Hostos Community College, and awarded our first 3 scholarships to undergraduate students. We had our summit, our roundtable members, where we convened the presidents of all the Hispanic members of our roundtable to look at, discuss issues around workforce development in healthcare. And certainly last but not least is we convened a number of quarterly forums on professional development with the support of the Greater New York Hospital Association, where we brought managers in from different healthcare institutions and members of our Managers Council that is co-chaired by our two co-chairs, Clara Irizarry. Clara, thank you. And Andy Nieto. We also have a few other leaders from the council. We have Domingo Arroyo, we have Wilson Davila, and we have Juan Mejia. As many of you may know, Juan is one of our rising stars and just recently became Vice President of Operation at New York Presbyterian. So we're very excited about our new leadership. The benchmarks that we are also celebrating is that in April, we were selected by Aetna as one of their 47 semi-analysts in their finalists in their Voices of Health competition. The final competition will occur in August of this year. So those of you who are familiar with Facebook, we have to reach a number higher than was reached last year, which means that we have to get over 140,000 votes. So that means, unlike presidential elections, you can vote more than once. So you can vote 10 times. So we expect all of you to vote 10 times for AHED so that we get the grand prize of $20,000. So more information will come later in August. Also, and it gives me great pleasure tonight to announce that the Association of Hispanic Healthcare Executives is currently in negotiations with two organizations to form chapters out of New York. It's my pleasure to announce tonight that Truman Medical Center in Kansas City, Missouri, under the leadership of Cici Rojas, is in the discussions with us for a Midwest chapter. Cici, please raise your hand and stand up for us. Cici, thank you very much. It's also my pleasure, this is a double hitter, it's also my pleasure to announce that with the support of the Robert Wood Johnson University Hospital and Marty Everhard and Michael Connect, we are starting our New Jersey chapter and our negotiations with them. Will I have those two individuals stand up for me? Where are they? Okay. So as you see, our association is on the move. We're creating chapters. We're really excited. We want our voices heard. We want the voices of our community heard. Not only to address the issues that we're known for, which is the educational pipeline, leadership development, board governance, but ensuring that those of us who are in leadership positions are addressing the issue of access to health care, not only for the Latino community, for all communities. So on that, I want to thank you for joining us tonight. I want to thank you for your financial support, because we don't get support from government agencies, city, state, or federal, so we rely on support from the hospital industry, pharmaceutical industry, managed care, and corporate America to make sure that our mission is achieved. And if it wasn't without you, we wouldn't be here tonight. It takes me also, gives me great pleasure to announce the next individuals that are coming up tonight, and those are our two Masters of Ceremony. It's my pleasure to announce that we have two really outstanding Masters of Ceremonies. I mean, last year we had a hard time getting one. So look at this, we have two of them this year. So first Master of Ceremony, I'm going to ask him to come up to the stage, is Mr. well-known Mr. David Navarro, co-chair at WABC TV at 4. Thank you. It's also my pleasure to announce his co-master of ceremonies, Denise Oyer, who is a renowned chef, representative of AARP, chef for none other than Goya Foods, and her credentials are endless. Emmy Award-winning journalist with Telemundo and Univision. It's my great pleasure and honor to introduce our Masters of Ceremonies tonight. Thank you.
Good evening. Buenas noches.
Hi, everybody. Great to be here. You know, it's so exciting. here that this is once a year you guys have an opportunity to basically do a shout out for yourselves.
Right.
And what we're trying to do here, I mean, we've got a lot of people we're going to honor tonight. We know that everybody's busy, it's a hot night, but we want to give a lot of you the due and respect that you have. You've been doing so much for the community, so much is happening in healthcare, diabetes, access to the elderly, so many that you know the story better than us. And we want to have that opportunity today to just kind of say thank you, name you. It's a New York City shout out. And by the way, speaking of New York City shout outs, there's a lot of New York Puerto Ricans in this.
That's right.
You know?
And let me tell you something. Estamos o no estamos. David and I, we've known of one another for a long time.
Couple years.
Couple of years, since we've both been on television for a couple of years. Well, I know him as a great journalist, an all-around fabulous guy, very handsome too. What I didn't know was that up until now, you're Puertorriqueño de Santurce.
Yes, Santurce.
Oh my God, that's a thrill. And
You know a little bit about the island, don't you?
I know a thing or two. De Santurce a Ponce, de Mayagüez a Luquillo. I just want to say before we start that I'm delighted to be here tonight sharing the podium with you, David, and with all of you addressing some of New York's finest professionals in the field of healthcare. And you saw me walking in holding on to David. Not only why would I not hold on to...
Come on.
Come on, to David Navarro.
No.
But I have to say, if you see me walking like a penguin, I had foot surgery not too long ago, but hey, what's a girl without high heels?
But
right?
you look great.
And I'm about to undergo knee surgery, but I'm okay too, because the man who's going to be honored as the Doctor of the Year, right here, Dr. Jose Rodriguez, where is he?
Our first shout out.
Yes, that's my doctor. All right, so let's start.
All right, we're going to start with having someone come up here to give some welcoming remarks. So let me introduce you to Dr. Joe Ivy Buford, President, New York Academy of Medicine. Come on up, and let's get this party started.
Let's go.
Good evening, everyone. We are absolutely thrilled to have you all here. As our colleagues have said, I'm the president of the New York Academy of Medicine. I want to welcome you, some of you to New York, but all of you to the New York Academy, and we hope this will become a regular activity. Commissioner Farley, Luis, and George. George, again, I don't think we can say enough about your leadership over the years, and this is a real work of passion for George, and the results show. So congratulations for this terrific group. Lots of honored guests, lots of honorees. Congratulations to all of you. We've been increasing our Latino representation, and also we are still about 65% doctors, but really increasing the representation among nurses, pharmacists, dentists, brand new dental section. In the recent social workers, lots of social workers, and podiatrists are starting a new section. And our nurse leadership group is everywhere as they wish to be. So we welcome many of you. We are the home. We are happy to host the National Hispanic Health Foundation, which is now here at NIAM for the last several months. And I've been working with, and we've been working with Elena Rios and the National Hispanic Medical Association for over a decade. So we're just delighted to add those of you who are managers, leaders of the health system into our midst. And our priority is urban health. We are focused on 3 areas: healthy aging, prevention, and eliminating health disparities. And we work very far upstream, really trying to change the communities in which people live so that they can have healthy choices. And so the healthy choice is the easy choice. We know behavior change is important, but many people don't have the choices to do the right thing. So we're really working on changing environments, and we're also, for the last 2 years, have been really engaging very directly in East Harlem and trying to really work with leadership in the community to identify what role we can play. And we're beginning to, I think, find our spot. So we're thrilled to have you here. I know many of you probably practice and work in these areas, in the communities in New York, and we're delighted to host you. Hope we'll see you in future years, and have a fabulous evening. So thanks very much.
Now I would like to greet Dr. Bruce C. Vladeck, the Senior Advisor at Nixera, and I hope I'm pronouncing it right. I did check on his website. He'll be introducing our keynote speaker and Health Advocate of the Year, Dr. Thomas A. Farley.
Good evening, everyone. I'm very pleased to be here this evening, but I'm very cognizant of the responsibility of the person introducing the keynote speaker to share some of the salient information and get out of the way, and I will do that as expeditiously as I can. But I'm not really a public health expert, but I am a chauvinist New Yorker, and I think I can say on the basis of overwhelming evidence that while a generation ago it may not have been the case, New York City now has the preeminent local health department in the United States of America. And there are a number of people who have contributed to that, but on a day-to-day basis, the personal responsibility and leadership for the 6,000 people who work in the New York City Department of Health and Mental Hygiene, and the over $1 billion a year it spends in promotion of the public health is Dr. Thomas Farley, who's been in that position for a little over 3 years now, although he had been involved as a consultant and advisor to his predecessor for several years before that. He came to New York directly from Tulane University, where he was chair of the Department of Community Health Sciences. He received both his medical degree and his master's in public health from Tulane, and trained at the most important training ground for public health professionals in the United States at the Centers for Disease Control Epidemic Intelligence Service. He's a widely published author. The breadth of his responsibilities because of the leadership and innovation ranges from tobacco control and taking on obesity to the establishment of the first locally based registry for A1C hemoglobin in the United States, to a really pioneering program in providing electronic medical records to community physicians, predominantly in low-income and minority communities. The people of color in the city of New York have had no greater advocate for their health care needs, no greater source of someone looking out for their health than Dr. Farley. And Tom, it's my privilege and pleasure to introduce you for your remarks today.
Buenas noches. Me honró de ser invitado a hablar a este apreciado grupo de profesionales. Por favor, perdóneme por hablar en inglés, porque no puedo hablar en español. Pero como pueden ver, lo puedo leer. I'm glad I got that over with. Seriously. I want to thank Bruce Vladeck for that nice introduction, and I want to thank George for introducing me here and giving me the opportunity to speak to you. I enjoy having the opportunity to speak to health professionals, particularly those that are seeing people directly, those on the front line. So I'm going to take just a few minutes to speak specifically to those of you who are involved in direct patient care. So let me just ask right now, by show of hands, how many of you still see patients? Okay.